and a research fellow at the University of Patras in Greece. What is extremely important about Konstantinos, and we will delve into that some deeper when we discuss the review, but he's the most highly cited researcher in 2019, which is a list of the highest impact scientists in 21 scientific fields, and most specifically in his work on tobacco harm reduction. So Konstantinos will be introducing the review that he's done on the use of flavors, and we very much look forward to that. Then this attractive gentleman is Charles Gardner. Charles Gardner is a PhD in neurobiology. He's from the US, and he's led a multi-stakeholder life. He was firstly a US government official, health attaché in a number of cities, including Geneva and India. Then he's also been a senior advisor to the WHO and to UNICEF, and the director of global health in no less than 3 foundations. The last being the Smoke-Free Foundation, and now is the CEO of INCO, one of the most prominent consumer movements in tobacco harm reduction. So we are delighted to welcome Charles to this panel. Professor Heino Stöver is one of the most effective champions in the field of harm reduction. He is a social scientist, a PhD and professor at a very impressive university, the University of Frankfurt for Applied Sciences. And he's worked in the field of social scientific addiction studies for decades, and has been the president of the most prominent harm reduction for drug user groups in Germany. He has published widely, including 4 books on tobacco harm reduction, and is widely acknowledged as one of the champions and most effective evidence-based speakers on harm reduction in Germany. Heino, we are so privileged to have you on our panel.
Thanks a lot.
I think Kgosi Letlape is a bit of an enigma, a friend and colleague through many years. He tends to break down barriers, and he would say he's an activist for health. He's fought all of his life for access, especially to the poor and disadvantaged, to healthcare products, science, equitable policies, and I salute him for that. He was the first Black ophthalmologist in South Africa, and if that was not enough, he became the first Black president of the World Medical Association, which is the global representative body for physicians, and he served in various other regulatory institutions as presidents, including the Health Professionals Council of South Africa. He is active in various fields, but in tobacco harm reduction in particular, he's been an avid and very persistent advocate for the rights of consumers. So with this wonderful panel, I think what the purpose of this meeting is to introduce the review done by Konstantinos on the use of flavors in tobacco harm reduction. And we'd like to delve into that review, but then specifically address the issue from various angles. Heino would talk about his experience in the EU and Europe. Kgosi will speak about the low and middle income countries. Charles from his various vantage points. And then Konstantinos will take us through some of the science that is needed to develop what we would all lobby for, and that is proportionate and evidence-based policy for all harm reduction products, whether it's in tobacco or alcohol or other fields, but today specifically in tobacco harm reduction. If I could give each of the panelists a few minutes just to introduce themselves and their stake in this particular debate, and then we'll move to Konstantinos to discuss the report. Charles, can we start with you, and then ask Heino, Kgosi, and then we'll focus on Konstantinos in the report. Charles, please.
Yeah, sure. So I do have a background in neurobiology, but ended up spending most of my career in global health, and specifically global health research and innovation, focused on HIV, TB, malaria, dengue, rabies, water sanitation and hygiene issues, child health, nutrition. Some of that work, especially at the Rockefeller Foundation, was focused on public-private product development partnerships for HIV, TB, malaria, and dengue vaccines, and medicines. And all we talked about was the things that you need. This will be for Kgosi music to his ears, but the things you need for access. The medicine, the intervention, whatever it is, it needs to be affordable, and it needs to be available, and it needs to be acceptable to the user, or nobody's going to benefit from it. And so the flavor issue often comes up with me personally, just thinking about those three things, because it's about reducing the palatability and acceptability of a product, which obviously means fewer people are going to use it. Now, I am the executive director of INCO, which is a nonprofit alliance of 37 member organizations all over the world. Our membership is growing fastest in Latin America and Africa, I'm happy to say. But we have a huge number of members in Europe and Southeast Asia, and of course, North America, where I am permanent at the moment. And we don't take any money from industry.
Excellent. Thank you, Charles. Heino, some introductory remarks from you.
Yeah, a few remarks. My name is Heino Stöver. I'm a professor here at the University of Applied Sciences in Frankfurt in Germany. And I'm in the drugs field for about 40 years. I'm the head of the National Umbrella Organization of Harm Reduction. And I was socialized in a way in the field of illicit drugs, HIV/AIDS, hepatitis, and so on. And therefore, we originally, let's say, implemented harm reduction strategies. But by now, we expanded the concept of harm reduction to illicit drugs, to legal drugs like alcohol and tobacco. Yes, and since 5 years approximately, I'm very busy in the field of tobacco harm reduction. And diving into a field which is being predominantly covered and closed, I have to say, by the abstinence-oriented movement, abstinence-oriented people, and there was no place for harm reduction, no space for harm reduction, and we are developing it now with more and more success.
Thank you very much, Heino. Kgosi, any first remarks from your side, please?
Well, my remarks with respect to this topic is, as you can see, I have the face of Madiba behind me, who taught us about reconciliation and consensus building. And I guess the challenge that we have in harm reduction is with the two opposing factions. Can you talk about consensus building, or should we be talking about compromise? And it's going to be a question of how we make the two meet. Part of the issue is extreme polarization. And I'm interested in today's topic in the sense where there should be a line that gets drawn in terms of where do we meet each other halfway? How do we ensure that this is not marketing and attracting those that should not be using the product because they are underage, and the issue of acceptability of a product. So we need to find the balance between, are we marketing or are we truthfully talking about acceptability of a product? You know, when we look at the discussions that we've had around vaccines, somewhere you got to a point where the people that produce the product, being the pharma companies, became the spokesperson about effectiveness. And at some point, you get a sense where the products were being marketed rather than people being educated by the products. So I guess from today, we would probably begin to have that line. And I hope we'll be able to have a robust discussion amongst ourselves, akin to how we were taught in medical school. I remember in ONG, for example, at the mortality meeting, there were no hold bar. They would have an open, frank discussion about whether that mother's life could have been saved or not. But at the end of the day, they came out wanting to make their efforts better in terms of protecting mother and child. So we need to also get to a point where we could thoroughly debate these issues and ensure that we protect lives and we save unnecessary deaths by promoting harm reduction without doing the marketing job for those that benefit from that, but ensuring that the recipients, the consumers, get safe products and are able to switch from the more harmful products.
Excellent segue into the report. The multidimensional review by Dr. Konstantinos Farsalinos. Here you see the front cover of this report that will be available on his own website, e-cigarette research, and also on other websites that this has been distributed to. But I'd like to now focus on Konstantinos and the genesis of this review, and ask Konstantinos perhaps just to introduce himself, and then I would like to ask him a few questions about his own journey in tobacco harm reduction, and then specifically on this review. Konstantinos, if you wanted to make some introductory comments. I think you're on mute. We'll just try. Jessica, can you just make sure that...
Yes,
there we go.
yeah, right now, please consider that we cannot unmute ourselves. We have to be unmuted. So I couldn't unmute myself unless the host unmuted.
Sure.
So, Delon, thank you very much for organizing this, and a big thanks to the panelists that were so willing to come and discuss with me. I fully agree with everyone, and I will start by saying that tobacco harm reduction, first of all, is a very controversial issue, in the same way that harm reduction has been a controversial issue mainly in the past, a few decades ago. We all remember what happened with harm reduction initially for intravenous drug users. We were facing the same difficulties, the same controversy, the same hot debate, not only between scientists, but also between regulators and politicians. And you know that in such public health issues, what matters is not only science, but also the translation of science and the implementation of science into laws and regulations. So the same difficulties were seen with other harm reduction approaches. But the problem with tobacco harm reduction is that it affects by far more people than any other aspect of harm reduction. A few years ago, we were having something like 15, 17 million intravenous drug users in the world. We have more than 1 billion smokers in the world. And this has been a problem for the past several decades. It's almost 2 decades since the reports from the Royal College of Physicians and the Surgeon General reported the adverse effects of smoking to health. And still, after 6 decades, we haven't solved the smoking problem. It has improved quite significantly, of course, but we have spent billions. We have tried a lot, but the problem is still here, and it still affects 1 billion people. So any reluctancy, any controversy in adding another tool to reduce the smoking prevalence costs millions of lives every year. The cost is too high for this controversy to remain and to be sustained. Now, flavors is, of course, one of the hottest topics in this controversy. And I fully agree with what Kgosi said previously, that, it's a matter of being realistic. In reality, we have to be realistic versus facing the idealism, the ideal world of no people using any substance that could result in dependence or addiction. And if we want to be pragmatic, if we want to be realistic, we have to understand that if we want to add the aspect of harm reduction, and harm reduction is mainly a behavioral approach, a behavioral intervention. It's not a medical intervention. It's not a treatment. It's not a medication. We have to accept that acceptability of use and appeal to the smoker is one of the main drivers that will encourage a smoker to make a switch, to quit by switching to a less harmful alternative. And flavors play a crucial role in that. If we make these products very expensive or not tasting so well, not bringing to the smoker the experience that makes him continue to smoke, because we must provide to the smoker what the smoker wants from a cigarette. In this respect, flavors, especially electronic cigarettes, do not only play a role of acceptability and preference, but they may also eventually play a role of further moving a smoker away from a cigarette and reducing relapse over time. Because what we have seen in several of our surveys, mainly cross-sectional surveys, is a very clear transition over time of someone who initiates e-cigarette use and quits smoking. We are seeing a transition from the more familiar tobacco flavors to other types of flavors, and this involves adult smokers who have quit with e-cigarettes. I will give you one characteristic example, and I have the permission to do so. My mother, who is 72 years old, and she was a more than 50-year smoker, she had to quit because she had some respiratory problems that she didn't want to face and realize initially, but over time they got worse. And the only way that she could achieve that was through an e-cigarette. But at the age of 72, she's using cappuccino and fruit flavors. Right. She has been a 50 years menthol cigarette user, a menthol smoker, and she now uses for the past 3-4 years cappuccino flavors and now fruit flavors. She has not used any tobacco flavors for the past 4 years. So we usually hear the argument that flavors are available in order to attract youth, in order to attract kids and adolescents. Well, no, I'm telling you about elderly people who are using flavors that no one would imagine they would use in a tobacco cigarette. And that's not, a single case. The vast majority of sustained e-cigarette users who have quit smoking and have been using electronic cigarettes for a long time, they transition to other types of flavors, to non-tobacco flavors. And it's very important for them. The experience that they perceive from this is very, very important. And we cannot ignore that. We cannot ignore that. We have
Can I just ask?
Yes.
No, so
yes,
while we are talking about your mother, I think it's really important for our guests to also perhaps hear your own story that I've heard you disclose at the conference before. Your own journey from being a smoker to quitting. Did that involve flavors as well?
Definitely. I will tell you my experience also. I was a 20 years smoker, almost 20 years. And I had tried repeatedly in the past to quit. And I had tried, well, once only by myself. I found it extremely hard to quit by myself without any aid. But I have used both bupropion and varenicline immediately at the time that they were imported and available in Greece. The thing is that I was always successful, but I was successful for a very short period of time. So I had quit smoking for 3 months, for 5 months. I think that 5 or 6 months was the longest period that I maintained smoke-free. and I always relapsed. You know, relapse is a huge problem. When the first time that I heard about electronic cigarettes, I knew nothing about it. The first time was when two of my closest friends sent me a photo of themselves vaping, and they were smokers. So they bought, and they were using an electronic cigarette. That was in late 2011. And initially, you know, I made fun of them. I said, you know, you're just wasting your time and your money to useless products. You know, that was my opinion without even knowing what an e-cigarette really is. I just knew that they existed. And I offered to prescribe them varenicline if they wanted to quit. Well, they kept on sending me photos of themselves, and that's how the idea of working on harm reduction, on tobacco harm reduction in electronic cigarettes was first created. And that's how my journey as an ex-smoker also started, because while I was doing my first study in the hospital bringing electronic cigarette users, and I was still a smoker, I remind you, that's when I decided to try an electronic cigarette myself. And at that time, it was February of 2012. That was the last time that I ever smoked a cigarette since then. So I do have personal experience. And I'm one of the many, many smokers who have repeatedly tried to quit using approved medications, not just, you know, the most popular method, which is trying by yourself without the use of any aid, but with approved medications. And it worked, but it didn't work for a long time. We have, I think it's our ethical duty to add more tools in our effort to reduce the smoking prevalence and to help smokers individually. And that's for individual health, but also for public health eventually. Because if we care for each and every smoker, and if we understand the needs of each and every smoker, eventually we're going to have a public health benefit. Of course, there's no doubt that flavor is also a controversial issue. It's an issue that is related to the appeal to youth and to adolescents. But I think that we need to carefully strike the balance between appeal and acceptability for adult smokers and appeal to youth. And we can use other measures to reduce youth access to these products instead of compromising their effectiveness for adult smokers. We need to,
on that note, Konstantinos,
we need to have an holistic approach.
On that note, to Konstantinos, it's a good bridge to the review that you did. I noticed that in this review, there are 343 references. And I know that your objective in developing this review was to make sure that evidence-based policy can be possible in the use of flavors and tobacco harm reduction. And if I can just show the audience the basic contents, where Konstantinos has looked at the different dimensions of the whole flavor debate. He firstly looked at flavors used in tobacco harm reduction, including the use of flavors in nicotine replacement therapy, which is on the WHO's list of essential medicines, is a recognized form of smoking cessation. Then he looked at the different scientific articles on flavors in especially nicotine vaping products or e-cigarettes, safety studies. He himself, along with Chris Russell, did an extensive survey of 60,000 vapers in the US, which you must please read in this review as well. And then this year it's had unparalleled attention from some of the regulators, including Canada and the Netherlands, where a proposed flavor ban was discussed, and there were global consultations on this. So some of the most important submissions are noted in this review. And then I'm very happy to say, for Charles' sake, that the consumer dimension was addressed in this review. And then at the heart of the review, Konstantinos looks at some of the unintended consequences of flavor bans, and then some of the conclusions and recommendations. And if you, this report will be sent to everyone that's participating in the webinar, but this is basically, if you look at some of the key evidence that Konstantinos has cited, and then some of the conclusions that he has come to, including that it seems that flavors in e-cigarettes are really inextricably linked to smoking cessation. So Konstantinos, can I just ask, you put this together so that constructive evidence-based debate can be possible. What would you like to achieve with this review in this, let's say, the next years moving forward?
Well, I think that the flavors issue is one of the most important issues that we're facing now in the tobacco harm reduction and the e-cigarette debate. And the reason is that exactly what you said, flavors are crucial, probably the main determinant of their success. And I would say in general, appeal and taste of a product plays a huge role in helping smokers quit. And what makes e-cigarettes appealing is the functional characteristics and the patterns of use, which look very similar to smoking, but also the taste. The taste is crucial. You know, the taste is crucial for everything, for whatever we eat, whatever we drink. We don't like flavorless products to experience something which is flavorless. Unfortunately, the electronic cigarettes are flavorless unless you add flavorings. Even the tobacco flavor is not the natural flavor of any cigarette. It's an added flavor. It's added ingredients that generate the tobacco flavor. The same is happening with everything else. Now, the issue, as I said, is that you expect a smoker to initiate e-cigarette use or a use of any other alternative product with something that resembles smoking. And yes, that is partially correct with e-cigarettes, because we've seen in other studies, for example, in a large survey we performed in the US, that the situation is different, that many of the vapors initiate with non-tobacco flavors too. But what we are seeing globally is a very strong transition over time, which means that people and smokers don't want to experience the tobacco flavors anymore. They want to transition to something better, in their opinion. And that's the transition we are seeing. And by restricting or banning flavors, we usually are going to achieve the exact opposite. We are going to make the product unappealing. And we are going to, and that's going to be risky, not only for smokers who want to make a transition, but also for already established vapors who are now using all these flavors and are suddenly going to be deprived of these flavors. Now, the ideal situation would, of course, be to quit using e-cigarettes too and be former smokers without using any alternative product. Unfortunately, reality has taught us that it is very likely for these people to relapse back to smoking instead of stop using electronic cigarettes or maintaining their use with flavorless products. We know that flavorless products represent a very small minority of e-cigarette consumption. Tobacco flavors, yes, someone may transition back to tobacco flavors, but we are disrupting their routine and we are disrupting their journey away from cigarettes. And this is very risky. It is very risky, and we may see a relapse back to smoking, let alone we are going to prevent other smokers from switching. It is something that we need, not only as scientists, but most importantly as regulators, we need to examine very, very carefully. We need to strike the right balance. And we have many other tools to combat the adverse effects of flavors in unintended populations from a public health perspective. And I'm talking about their appeal to non-smokers, to youth, and to adolescents. We have more tools, but we don't have any other tool to substitute for the flavor and the perception and the appeal of these products to smokers. We need to have products that are acceptable. We need to have different products for smokers to choose. Of course, there are other issues, and I'm seeing some very interesting comments in the chat with which I fully agree. There is an issue of packaging and labeling. We have seen, especially in the United States, a huge problem with packaging and labeling, with cartoon images, with images that are kid-friendly, that may be appealing to children. And this is, of course, a problem. And this is an issue of irresponsible behavior from the producer side. But these are issues that can be addressed through regulation. I'm against plain packaging for these products, but that doesn't mean that we cannot apply some regulations that will ensure some specific standards in relation to packaging and labeling what someone can use. However, I can also say that, this is not the only issue. Let's not forget that the products that created some problems in the US with the use among kids were not using kid-friendly packaging. So that's not the only issue. An holistic approach in terms of regulation, addressing all the intended benefits and unintended harms, is the only way to move forward. There is no one single decision, one single rule that is going to address all the issues and at the same time make these products appealing. We need a multidimensional approach. But in order to do that, we need to strike the right balance. I think we are moving towards the wrong path when we see governments either banning the products, all of them, like what happened with India, or when we are seeing governments, especially even in Europe now, trying to ban flavors. I think this is going to be a very serious issue that we need to address immediately. And unfortunately, we haven't focused a lot on flavors over the past few years, although all of us knew, and we had the experience from tobacco products, and I'm talking about combustible products, that flavors have always been the issue, and they were rightfully so banned from tobacco products. We can't face the same situation with e-cigarettes, because e-cigarettes are not just consumer products. They are smoking substitutes. So we need to see the different perspective. We need to have a different approach. It's not just a product that is available in the market for people to use. It's a smoking substitute. We have to understand that. We have to understand the prospects that this brings up, and we have to adjust our approach from a scientific perspective, but also from a regulatory perspective, we need to adjust it accordingly.
Thank you very much, Konstantinos. Let's go to our panelists and ask for their remarks on the review. They've looked at the review and they have some remarks. If we can start with Heino, and then Charles, and then to Kgosi. Heino, please, your remarks on how this can be used to eventually develop some evidence-based policy.
Thank you very much, Delon, but thank you very much, Konstantinos. It's been a great review, a very fantastic report I read in the morning, so I'm fully in the stuff. So great that you mentioned the crucial role of flavors in terms of increasing the appeal and the taste, and that's exactly the secret around the whole discussion around the devices of the tobacco heater and electronic cigarettes. And thanks also reading your interventions in Canada and in the Netherlands, where flavors should have been banned or reduced or limited to a few flavors only, which is not, I think, the right step. And so we are quite of the same opinion. Flavors are not that much debated here in Germany, but when I look to Europe's Beating Cancer Plan, for instance, and the additional SCARE report you mentioned as well in your review, there is huge opposition towards any harm reduction measure, not to speak of flavors. And this led to the situation also for my country, for Germany, that we adapted and adopted the goals from Europe's Beating Cancer Plan, trying to achieve a 5% smoker rate in 2040. But this should be achieved without any talking about harm reduction or any support of harm reduction or the use of flavor and the substituting policy. And I think this is completely unrealistic. Neither in Europe nor in Germany in 2040, we will get down, for instance, in my country, from a 28% smokers prevalence in the adult population. So we have to talk about harm reduction. And there's a growing movement against this solely abstinence-oriented concepts on European level as well as on German level. And you marked that completely well. So finally, we got into a European or an international association on smoking control and harm reduction called SCORE. And this is supposed to be an international worldwide network. You are based there as well, Konstantinos. And all in all, with your review, you did a fantastic job. Delon mentioned already the references. It's sort of a interim byline, we could say, listing together all the relevant literature and references we need in our scientifically based discussion. So a very great job, Konstantinos, and happy to multiply it. Many thanks.
Thank you so much.
Thank you very much, Heino. Thank you very much.
Charles, your views, please, and please hold back no punches. Say what needs to be done to push forward this flavor debate, especially the science thereof.
Well, I mean, this is not a punch, it's a kiss. I could kiss you, Dr. Farsalinos. And I truly want to compliment you personally and on behalf of INCO as well, that this is a tremendous resource. It reads well, it is fully referenced. It is a great resource for anyone in this area. And it's going to be extremely useful for all of us on the advocacy side of things. And it relates to some work that we're doing ourselves. So as we move into January of 2022, the theme of the month is going to be on flavors. And so we'll do everything that we can on social media and when I'm speaking and so on to share this incredible resource. I will just, so two other issues, but I'll reflect first because I do a lot of thinking about this too. And there's a space in thinking about flavors that has nothing to do with empirical science, and it just has to do with logic. Right. So let me talk about that, and then I have an announcement I want to make about something quite complementary to what you've done, Dr. Farsalinos, and again, compliments. So just dealing with logic, there are 3 points that constantly occur to me. The first is with nicotine gum. Nicotine gum has been available for 3 decades. It's available over the counter in the United States and many countries. For 3 decades, it's on the World Health Organization's essential drugs list, right? Nicotine gum comes in fruit flavor, fruit medley flavor, cinnamon flavor, mint flavor, and menthol flavor. And it doesn't come in tobacco flavor. And the reason, obviously, is that the pharmaceutical industry knows that no smoker trying to quit would ever buy that. And if no one uses it, it doesn't help anyone quit smoking. I think we can draw that parallel, and it's very strange that we're talking about vaping flavors, but not just vaping flavors, nicotine pouch flavors. and snus flavors as well. In the same vein, we're going to get all these flavors banned soon if we're not careful. The second logical observation here is that the same organizations that claim that nicotine vaping is a gateway to smoking, so teen vaping is a gateway to smoking. I mean, think about the logic of that. Okay, in the United States, 80% of teens who vape are vaping flavors, which, by the way, everything is flavors, just as Dr. Farsalinos said. It's all artificial flavors, but so we've artificially called one set like fruit and dessert flavors, and tobacco flavor is not a flavor. Okay, so most teens who are vaping at all nicotine are using flavors, and the gateway theory is an argument that vaping flavors is a gateway to smelly, stinky, disgusting, deadly, combustible tobacco smoking, right? The same arguments who make that claim are arguing that if we ban all flavors except tobacco flavor, so only tobacco flavor remains, it will reduce teen vaping. And the implication there is that tobacco flavor is some sort of teen repellent. Now, these two arguments they're said with a straight face and by the same people and by the same organizations, and they're mutually inconsistent. It's a logical conflict. And in fact, neither of those arguments is correct. So that's why they can do that. And then finally, I want to talk about bicycles, which is just simply, in the United States, by my calculations, 94% of the people who vape in this country and plausibly own a device and buy the products. And if you don't do that, you're invisible to market research, and you don't matter to as far as companies are concerned. 94% of them are adults. I know that would be quite shocking to most Americans and a lot of people in Europe and elsewhere. And as Dr. Farsalinos knows, about 80% of them are vaping flavors. And so it's not surprising that 80% of e-cigarettes and vape liquids are flavored. So it's not surprising that 80% of teens who vape flavors. They're just using what's available to them. And it very certainly doesn't imply that if you ban flavors, it's going to change the dynamic. So think about bicycles. If 80% of bicycles are red and 80% of bicycle riders ride red bicycles, we would not assume that banning red bicycles will reduce teen bicycle riding. Nor would we assume that the color red is designed to lure teens into bicycle riding. Anyway, so I mean, the argument collapses on a just pure, simple, logical. Oh, but finally, INCO compliments you again, Dr. Farsalinos, and we ourselves are about to produce a flavor report, much shorter, much less well-referenced, but with a different purpose. And this is our advice to policymakers. And it's basically starts out and says nobody should even consider a flavor demand without first conducting a careful health impact assessment to find out how many adult vapers will relapse to smoking, how many fewer smokers will quit, how many teen vapers will switch to e-cigarettes, how many bootleg products will arise where the products may be less safe and will certainly be sold with no age checks. And so that's right. Then we've referenced below that, but now we're going to have to change it. So this is where the punch comes to Dr. Farsalinos, because we're going to have to add a reference to your report, and if there may very well be some very good references there, we'll also want to incorporate. But thank you so much. It was a great read.
Thank you, Charles. Kgosi, your remarks, please.
Well, Delon, I'll echo what has been said about the fact that this is a great paper that will come in handy. I mean, in my country, in South Africa, would be able to cite it and present it to Parliament, present it to the Ministry of Health. And if we have to go and litigate, we'll present the evidence in front of the courts. We fortunately have a system where evidence can be led. So really, it's invaluable work, and we depend on scientists that do proper scientific work, like this product, that can be used for advocacy and to educate.
Yeah.
And my comments will be brief, Delon. We got to understand human nature, that even if you're promoting something that is going to save lives, people still need to be incentivized. And I will just give you a few examples. Currently, we are in a COVID-19 pandemic, and very few people that are reasonable would argue against the benefit of vaccinating.
Right.
But even with that, with all the evidence of the benefits of vaccination, many governments have had to provide incentives for people to vaccinate.
Yes.
You know, sometimes people were given cash prizes, they were given free coffee, they were given free rides, but incentives had to be provided. Some of the incentives are slightly packaged differently. If you're vaccinated, you can go to the theater, you can go to a restaurant, you can go to a sports stadium. So incentives are being provided, even though you see COVID deaths, you see long COVID, and people still need to be incentivized to save their lives. Smokers are no different. They still need to be incentivized, even though we know that these products are less harmful. You still need to put incentives to help them go that way. And one of the key incentives in these products is flavors. So you take the incentive away, knowledge alone is not going to make people convert. I mean, if you come across someone that is trying to commit suicide and is on a ledge of a building, wanting to fall down 50 stories, if you don't provide incentives to them, they're not going to come off the ledge. So even in that situation that is an emergency, you need skilled negotiators that could make it worthwhile for the person not to take their life. And you need to incentivize them to come off the ledge. So incentives are important. The issue of appeal and taste, we can't emphasize it more. I mean, we've had all these lessons about sugary drinks and the obesity pandemic. But those of us that have been addicted to Coke like myself, I wouldn't just go to something that has less sugar. If it didn't have the appeal and it had an aftertaste, I abandon it and I go back to the harmful product. So the producers had to work on making diet drinks appealing and make them taste well, so that I can then switch. So we need to be able to put the argument where the people that purport to be against flavors are actually not against flavors.
Yeah.
They are against vaping. And they are using the issue of youth appeal as an excuse. And we've got to be able to engage in society and call them out. They are the equivalent of anti-vaxxers.
Yes.
And COVID gives us an opportunity to speak to these issues in a language that the public will now understand.
Right.
So that we have a right to ensure that people have credible information so that they can make informed decisions. So there are many parallels from the COVID-19 situation that we should utilize, where everything has been based on science. I guess the biggest problem is that for COVID, the WHO is on the side of truth. For tobacco, the WHO is not on the side of truth. So for those of us from low to middle income countries, we got to call out the WHO.
Right.
And we got to ask our governments to stop acting like colonies and think for themselves and engage the societies that they live in. This is time for us to utilize the underutilized commodity called common sense. And we need to revive its usefulness globally. So in summary, Delon, my comments are that we should engage, we should listen, and we should contribute. And what Konstantinos has given us is a major contribution to be able to educate. Thank you.
Excellent. Thank you so much, Kgosi. And I joined our panelists to congratulate you, Konstantinos, on your lifelong work or career-long work, but also this latest contribution you've made. Can I give you a chance to just give some remarks following the panelists, and then I have some questions lined up for the last phase of our webinar. Konstantinos, please.
Yeah, I think Kgosi was right, although I would be quite reluctant to use the COVID example, because in COVID, we are basically punishing non-use. We're not incentivizing use. We're just bringing back the rights that everyone had by the use of vaccines. In this case, we need to truly incentivize, provide incentives to smokers, and appeal and preference and liking a product is one of the most important incentives for a smoker to use. People smoke because they like it. They get some positive experience. We know this even pathophysiologically from what nicotine does to the brain when a smoker smokes. All these changes that are happening inside the brain with dopamine receptors. So we need to provide some pleasure and a positive experience to the smoker. This is a very big incentive. But it's not only that, price is also another incentive, but we're now discussing about flavors. People, it's the nature of humans. They don't like something which doesn't provide any positive experience. Why would someone use something which is for which you are indifferent? You don't have any positive or negative experience. It's something boring. People don't like to use boring things. Smokers don't find tobacco cigarettes boring. We can't provide them with another product which is boring and ask them to switch. I think Kgosi was right. The health incentive is not good enough. It hasn't been good enough for 6 decades. We are providing them with medications. We are providing them with nicotine replacement therapies. It's not enough. Knowledge, every smoker now knows the adverse effects of smoking. It's not enough. So the improvement in health incentive is not good enough. We need to provide them with more. There are people, especially poor people, who are spending a significant proportion of their income buying cigarettes. They're doing it. They're not, even the financial incentive is sometimes not good enough. But when you have an alternative that works like a tobacco cigarette in terms of the behavioral aspect of smoking, provides nicotine and has some pleasure, some experience, and even more importantly, it may help a smoker transition further away from a tobacco cigarette by providing an experience and a flavor that is very, very different from a tobacco cigarette. I think that we need to find other ways of adversing the unintended harms, potential harms of flavors, which is children and non-smoker appeal, than finding, the easy solution, but it's not really a solution, of banning flavors, because it has banning flavors has important unintended adverse effects. And this is exactly why we are discussing about striking the right balance. We need an holistic approach, which is not about what can go wrong with flavors, but we need to also address what is right with flavors, what is important and why flavors are important. And this is where we need to strike the right balance. I'm afraid that we're not doing that. I'm afraid that we are losing our path and we are only looking at potential harms, which are not even there. I mean, yes, we've seen in the US that e-cigarettes have grown in popularity over the years, but at the same time, smoking has been reduced, the smoking rate has been reduced to unprecedented, and I'm talking about low, very, very low levels. The lowest rates, smoking rates among adolescents historically. Basically, the US is going to face a smoke-free generation. That's what the next generation is going to be. But no one cares about that. They care about the growing popularity of cigarettes, which in the vast majority of cases is experimental, unless adolescents have reported past or current smoking histories, tobacco cigarette use. So the getaway to smoking effect is not very convincing because the smoking rates have plummeted, literally plummeted. The common liability model is much more, I think, interesting and much more applicable to this situation in addressing why kids, adolescents, and even smokers want to use other different products. But again, it makes no sense to use a smoking substitute and deprive it from one of its main advantages, which is, you know, the vast array of different flavors, and which means that we have products that will fit to the preference of each and every smoker. We need to be very, very careful with that. We are compromising not only the prospects of smokers who may become in the future smoke-free with e-cigarettes. We may even be compromising of already established former smokers who are using electronic cigarettes. And this is something that we need to examine and study through research very, very carefully before making the decisions. It's going to be very late if we first make the decisions in the regulatory framework and then just accept and just watch the unintended consequences coming out. It's going to be bad policy, and we need to avoid that at any cost.
On that point, Konstantinos, if I could open up the floor to all of the panelists, there's some questions from our audience, and I'd like to thank the audience, and please add any questions you have in the chat or in the Q&A function of the Zoom. To your last point, there's a question, what is a kid-friendly flavor? I think this points also to one of the big issues in the debate, whether there's a kid-friendly flavor in substance or only in terms of its descriptor. So if it's a zooty mint flavor and it's potentially intended to attract youth, but are there any inherently kid-friendly flavors? Konstantinos and Charles, please chime in.
Well, to be honest, as a consumer and being in very close contact with other consumers, and even looking at the preferences of adults for other products, I mean, I don't know many adults who don't like chocolate. I don't know many adults who don't like bubble gum. I think that the main problem is the way that these are marketed in terms of the terminology, so the names, in terms of the appearance, so the packaging and the labeling. I think this is where we are having a problem. And sometimes in terms of the marketing strategy and marketing tactics of the company, which includes, of course, the name and the packaging. So in my opinion, this is where we could focus. And as I said, I'm not in favor of plain packaging for electronic cigarettes, but at the same time, we must set some standards and avoid kids-friendly packaging and labeling and naming. We are seeing problems like that, not so much in Europe, but mainly in the US. This is where, and I have noticed that several years ago through my trips, that there is a problem with packaging, labeling, and even the naming of products. But this is something that can be very easily addressed without sacrificing flavors for adult smokers. I think that there are ways, and you don't need to be very clever. You just need to be more confident in your approach. You just need to understand better the prospect behind these products. And if you do that, in my opinion, it's not going to be very hard to find the right balance. And of course, always, you need to monitor the situation. Monitor and be flexible enough to make adjustments to the regulatory framework and to your approach. So research needs to be continuous, and through research, it's going to be the results of research that are going to drive decisions. But as I said, we need to look at it holistically, from multidimensionally. We can't focus only on one aspect. That's, I think, in my opinion, a typical case of confirmation bias in that respect.
Good point. Charles, anything to add on that specific point? Because the youth issue is obviously central to this debate.
One example of a flavor that is considered a kid-friendly flavor by opponents of safer nicotine vapes is cotton candy flavor. Well, I checked more than a year ago, 75% of all of the cotton candy, I mean, the real cotton candy, the physical stuff you put in your mouth and eat, is consumed in the United States, is consumed by adults, not children, right? So, and I have been looking for the data on just candy sales by age, and I have not found it yet. But my assumption is that 2/3 to 3/4 to 4/5 of all of the candy in the United States is eaten by adults, not teens. That would not surprise me at all in the least. But I do agree that we can separate the actual flavor and taste from the packaging and labeling. And that is one of the compromises that we would be willing to make as a consumer group, that I've even seen proposals.
Oh, well, that's about, but please continue. You've seen a proposal?
Oh, I'm taking that as a signal I should stop.
No.
So I've seen proposals that, make all e-liquids just in white boxes and just number each flavor. So number 1, number 2, number 3. Actually, some wines do that, by the way. And it doesn't hurt their sales. That would be an extreme version of a kind of plain packaging, no descriptors whatsoever. It's not ideal, and it's not gonna be about a positive in helping smokers quit. I would put it that way, but it wouldn't be the end of the world. And so I think that these are areas where we could compromise. But the thing is, you could make any flavor whatsoever and simply call it tobacco flavor by some national laws, and I guess then it would be okay. Now I know in Europe they're talking about very specific, like 30 ingredients that would be allowed, but the people making up these rules have no idea what they're talking about. Yeah. That's another one of the problems here.
Thank you, Charles. That's an interesting and progressive set of recommendations from your side. Thank you. Heino, there's a question here. In the US, we have many people in government that don't follow, even look at studies from other countries, and it's difficult to confirm and to promote the benefits of vaping and harm reduction. Now, in Germany, you've been able to raise awareness and bring focus on the potential benefits of harm reduction in tobacco. What would your suggestion be to other countries and for their governments to firstly analyze and then to at least acknowledge the potential benefits of vaping as a harm reduction method?
Yeah, I think what I could recommend is, of course, an exchange of views. What Kgosi already mentioned in the beginning, consensus findings, something like that. We proceeded like, we did a lot of conferences, so we organized an exchange. We did a lot of webinars, publications. Partly I thought we are doing something as a counter public against this dominating abstinence-based and abstinence-oriented policy and guidelines. So since 5 years, we're doing quite a lot, and the number of, let's say, people who support harm reduction is growing in the field of experts. So I can now invite people or experts to conferences who 5 years ago were strong opponents of any approach in that direction. Yes. And so I see a lot of people well named who now speak on our conferences, and I think this is one way. The other way is definitely, let's say, as Charles said, and what Charles is representing is giving the consumers a voice. They have a say, and of course they are a strong community who could, let's say, who have to have a seat at the table, as Konstantinos said in some part of his review. And this is something to organize as well. And in Germany, this organization is also growing. So it's a bottom-up movement, I would say. Right. Sort of a grassroots movement. And yeah, but we are touching, let's say, the national bodies already. So we've come to the governmental structures already. And yeah, that's what was our way was. And I can strongly recommend these strategies.
Thank you, Heino. And then Kgosi, there was a question specifically on the South African Ministry of Health Department, and how to get them to consider some of the studies referenced and explained in the review that's been published by Konstantinos. How would you get government to actually take notice of the science?
By bringing it to their attention, basically engaging with the relevant officials that are responsible for this product. If we have access to the minister, being able to say, Minister, here's a courtesy report for you, a complimentary report for you, a useful reading. Here's work that has been done scientifically based on flavors. And we engage them so that people become educated. I find that one of the reasons why people resort to bans is because they are lazy or they are ignorant. And the one way to overcome that is to be able to provide them with information and to educate. But also the other aspect would be being proactive. For example, vaping is available, but it's unregulated. So those that provide the vapes must begin to regulate themselves. They should have their own discussions about flavors. They should have their own discussions about access and what steps they are taking to ensure that this are not accessed by children. You know, and all those issues, the steps that are proactive might help. And we need to be able to engage, and different nations might come up with different things. There should be room for a basket of flavors that are accepted, that are standard. You know, maybe a dozen of them. And any fancy flavors should still be available in the proper name of that flavor, but that should be in specialist stores that can only be accessed by adults. So that might be part of the discussion that we need to engage in, where we're beginning to say standard flavors should be generally available in convenience stores so that it's easy for those that use them. Specialist flavors, let them be in specialist shops so that you can then regulate that you are not attracting children to that. Those are things that we should be able to engage and discuss and come up to a consensus with, where we seem to be concerned about youth uptake. And we are meeting each other halfway about how those things should be done. But the key issue is this is a consumer product. We need to come up with mechanisms of being able to educate the public and the consumers on these issues. It shouldn't just be reserved for regulators and governments. We should educate the public about these issues. And there's also other things that we never do any work about. The benefits to others of switching. The smell, the secondhand smoke, etc. We are not talking about those issues. And those are things that we should be engaging with the public about, so that the public has to understand that when you switch from a combustible cigarette, not only do you have health gains for yourselves, there's also massive gains for society and those that live with you and those that are around you. So we shouldn't just focus on the governments and the regulators. We should focus on the public education.
Thank you for that, Kgosi. And Konstantinos, switching to Europe, last Friday, the Europe Beating Cancer report, the Becker report, was finally adopted by the Commission. Here is a question. In its Beating Cancer plan, the European Commission suggested to ban flavors in the next tobacco products directive. Do you think this can be reversed?
It's going to be really tough. You know, I have been expecting the climate and the environment from the US, which was mainly focused on flavors, to come to Europe. I think it was inevitable. It's been happening. However, I don't see any real documentation and any real evidence of a problem with youth use of electronic cigarettes in Europe. It hasn't been documented at all. Even in the US, where it has been documented, you know, the definition of current cigarette use in Europe, in the US, is having even one puff over the last month. So you understand that that's not current use of any product, to be honest.
Yeah.
In Europe, we don't have any documentation of a real problem. So I don't know if we are just trying to find a solution for a non-existing problem, or in reality, we are creating a problem, trying again to solve a non-existing other problem. It's going to be very difficult because it is clear that the regulators have a predetermined opinion against electronic cigarettes. They are predisposed against it. There is a lot of pressure from respected organizations such as the WHO. There is some social pressure, which I don't know if it's coming from anywhere, because again, I haven't seen any real documentation of a kids or adolescents problem with electronic cigarettes. As you know, I've published also about the US situation. We need to look at two main important issues. One is the frequency of e-cigarette use, and the second is the smoking history of e-cigarette users, current and past smoking history. So this is very important in order to determine what is the impact of electronic cigarettes in youth. We haven't seen almost anything in Europe. So I don't know why they're in such a hurry and they are so confident that they are solving a problem by banning flavors. I don't know why they are confident in thinking that they are preventing a problem by banning flavors. E-cigarettes didn't enter the market last year or in the last 2 or 3 years. They've been in the market in Europe for more than 10, 12 years now. So I think that we would have seen a problem in the past. I don't think we have a problem here. And I don't think that we are going to solve or prevent a problem by banning flavors. I think we're going to create a problem. And the problem is not only the lack of appeal and acceptability of products for the smokers. Another problem that we need to understand is the black market problem. Not only the black market, but the use of unregulated products, because let's not forget that the flavors used in electronic cigarettes are food flavors. And you can find food flavors in the market and mix and match final product yourself. If we end up in a situation like this, then it's going to be the regulators that will create an unregulated market, a market where someone can buy 2 products that are intended to be used in different markets, one for the food industry or food market for the e-cigarette market, and just mix those two together. They need to understand that banning flavors is not an easy solution. And banning flavors has many unintended potentially adverse consequences. And they have to understand that they need to look at the benefit also of flavors, not only at potential or possible unintended harms. Public health policy has never worked unless you take a multidimensional and holistic approach to this matter. You can't focus only on one aspect of the issue and come up with a perfect regulation. It's not going to happen.
Well, I have to join the other panelists to say that with your review, that's exactly what you've tried to do, is to address the different dimensions of the use of flavors in tobacco harm reduction. There seems to be an overwhelming consensus that the use of flavors in tobacco harm reduction leads to smoking cessation in one way or the other. We've heard some very interesting and pragmatic recommendations of how the issues with flavors can be addressed, such as looking at the descriptor especially. And then there's a question here, what's the role of a regulation or the regulation of product standards, quality assessment, and even good manufacturing practice in flavors? Is there a role for enhanced product standards or flavor standards? Anybody on the panel, please?
Well, to be honest, and discussing about the EU regulation, I think it's already good enough. We haven't seen any issue over the past year since the TPD was implemented in 2016, basically. It was voted in 2014, but the implementation in each member state began on 2016. We haven't seen any real safety concerns and safety issues with flavors. There are already rules and regulations about the ingredients of electronic cigarettes, which also include flavors. Of course, we need more research, but when you have a regulation that hasn't created any problem, why would you want to change that? Of course, it also depends, and I think Kgosi said that on the responsibility of the manufacturers, and the e-cigarette industry should also work within themselves and between themselves in order to also self-regulate the market. It's very, very important, not only in terms of appeal and accessibility to youth, but also in terms of product standards and product safety. But we already have a regulation in Europe, and I've always mentioned that, especially in Asian countries, that Europe has set the standard with the TPD. It's not a perfect regulation, but it is a very good starting point for countries which have not created any sort of a regulation for electronic cigarettes. I don't think we need to change something that has been proven till now to be quite successful. As I said, we need to be flexible, but our purpose is not to change the regulation just to say that we did something and we changed something. The purpose should be to improve any previous regulation. So you don't improve a regulation by changing things that don't need to be changed. I think we need to present this message to the regulators on a European Union level, but also in other countries. Kgosi, it's not only about being lazy, but also about being scared of something that they don't know very well, and they don't understand what the impact or the consequences are going to be. So if someone is scared of a disruptive technology, of something that is new, of something that the regulator, the politician doesn't know very well, then they will end up using the easiest approach, which is bans or very restrictive regulations. We've seen that repeatedly, especially in the past. And unfortunately, in many countries, this is also the main determinant of over-restrictive regulations. And I think that ignorance, which creates a sensation of panic that something bad is going to happen with these products, is what drives bans or restrictions in many regions in the world, even I think now in the EU.
Thank you, Konstantinos. Well, we're in the last few minutes. I'd like to make use of the opportunity to compliment you again on the review. Make sure that all stakeholders have access to the review. It will be on your website, e-cigarette research. It will be on several other websites, and I know that there will be many references to this publication on social media. So please watch this space. And thank you to you, Konstantinos. A big thank you to our panelists, and I'd like to give each one of you a chance just for your final remark. But I'd really like to salute all of you for the work that you've done to help prevent disease and premature death from tobacco-related disease in all of your works in all of your countries, and I know globally. I salute you on behalf of all the consumers who've managed to use tobacco harm reduction as a fire escape. Thank you very much. Charles, Heino, Kgosi, any last remark from your side, please?
I'm honored to work for INCO, a nonprofit organization that supports the rights of 98 million people worldwide who use safer nicotine to avoid toxic forms of tobacco, including 68 million who are using e-cigarettes. And then, somewhere between 20 and 30 million have actually completely quit smoking with these devices. So the number of lives that have been saved is enormous. And we are all ex-smokers. And so we have our own lived experience. We all know how we quit smoking, right? And it turns out everyone's different. There are profoundly different ways. I quit the same day I tried an e-cigarette, or it took me 3 months to quit. Or I never intended to quit. I just tried one and it suddenly happened. So quitting by accident is a thing. So we have our own testimonials, we have our own stories, but we can't do anything without people like Dr. Farsalinos, who are actually collecting the evidence to know, for example, that when smokers quit by switching to e-cigarettes, the cilia in their lungs recover full function. I mean, these are profoundly important things to know, and things we want to know. If we want to fix things, one of the things that we all would like to see is safety standards, GMP safety standards and ingredient safety standards, because then you can tweak those, right? It's not a big regulatory burden. You can tweak those as new evidence comes in from researchers, and so we stand on the shoulders of the people who are actually generating the evidence that we can then use and put in our report to back that up. There's a big challenge now because a lot of the evidence comes out of the tobacco industry itself, and nobody trusts them because they're the devil. And so we love that there is evidence coming from independent researchers who are not tobacco industry funded.
Thank you very much, Charles. I know.
Okay, as a former smoker, as Charles also is, I'm very close to the topic. And for me, it is very important to see that the whole discussion around vaping or smoking is led by an oncological perspective and an oncological dominance. That's correct, of course, when we think of smoking. But it is not applicable to, let's say, vaping products and flavors and liquid. So I think most of the discussants in the whole debate are completely underestimating the dynamic and the power of addiction. And let's say acknowledging this power of addiction, then we have to look for substitutes, and vaping is definitely the methadone for smokers, so we have to look for smoking substitutes. And e-cigarettes, tobacco heater, whatever, they resemble smoking to a very high percentage. And so far, I think this is the future. I always, let's say, see a parallelity between e-motors in cars and the e-cigarette movement. So I think both in 2030 will come to a common sense and a common goal that, let's say, the smoking products of both will be forbidden more or less, and then definitely vaping will be the future. And we're working hard on it to, let's say, increase the community of people who are supporting harm reduction.
Thank you very much, Heino. Last word from you, Kgosi.
But my last words are, maybe we should also change the way we talk. Instead of talking about the power of addiction, we should talk about the benefits of enjoyment. As Konstantinos says, people enjoy this, you know, and that's something that gets forgotten.
Yeah.
And that should not be forgotten. And just to reiterate that, part of what we should be using more is lived experiences. So when you get into the situation where there's a bill coming up like in South Africa, we need to mobilize those whose lives have been changed by switching to non-combustibles, to tell their story and to write in to the lawmakers, because otherwise the lawmakers are going to turn their life into a misery again. So we need to ensure that we bring the people to be up front and center of what we do. I'm a physician, and we put our patients first. And what I learned from the HIV battle that we had is that we could never have gotten anywhere without the people living with HIV standing up and we supporting them and coming to them and saying, how can we help you? So my last words is, we need to mobilize the people that are impacted, the people that are affected, the people whose lives will be changed by switching from combustion to non-combustion.
Thank you very much, Kgosi. Thank you very much to our panel. Konstantinos, thank you for your hard work and this review. We will do our best to make it available to all of the panelists and participants to this webinar and beyond. Thank you very much for joining us this afternoon.
Thank you, everyone.
Thank you.